Welcome to Insights, brought to you by Manatee Cancer Center. Insights is a multi-series podcast of cancer-related subjects, giving perspectives from specialists and cancer patients as they tell their real-life stories of victory, such as Sharon.
I'm Sharon Blake, a breast cancer survivor. I want to share my story of the most challenging and rewarding journey of my life. I hope you find these podcasts full of wisdom and inspiration.
The complete Insights series may also be viewed at manateecancercenter.com. Welcome back. This is another one of our podcasts. It's Sharon's Insights, and it's a podcast with the Manatee Cancer Center. And we're addressing issues as they relate to cancer. There's a series of podcasts, and today we're going to be discussing aesthetics and also some of the emotional effects in dealing with cancer. We have a number of wonderful guests, and we also have Sharon Blake, who is the inspiration for Sharon's Insights. Sharon, thank you for being with us once again.
You're welcome.
And why don't you tell them a little bit about who you are before I introduce these other ladies?
You asked me that before.
Well, I know, but no one has maybe seen this yet.
No, I'm a breast cancer survivor. Had breast cancer last year. I'm 48. Don't look it, please. No.
Not even close. You don't.
And I went through. I had a bilateral mastectomy. Went through chemo. Went through radiation, and I kind of flew through everything. I was truly blessed.
Yes.
Wasn't sick once, wanted to lose 20 pounds, wasn't happening.
As I understand it, you actually ate more.
I did. I was like a pig. It was a shame. I just ate. And
but that's actually a good thing.
It is, because the doctors kept saying that's good, but it was like, you know, when you want to lose that 20 pounds, and I think I gained the 20 pounds. But, you know, I went through it. I work at Manatee Memorial. I had my hair cut off after my second chemo treatment, and I loved being bald.
Yeah?
I did. I got the perfect head.
Do you? Well, as I've been told, you have to have the correct shape of skull.
You do. I had so many people just come up to me and just rub my head.
Oh, neat. Now, you mentioned about shaving your head. Did you end up actually losing your hair, or lost part of it and decided to shave it off, or how did that go for you?
Well, after the second treatment, the nurse said, you're going to start losing it, because it was down my back and I cut it short after the first treatment. And then I was on the phone to my sister-in-law in England, Sharon, and she was really emotional about all this, and I just put my hand in my hair and I come out with clumps, and that's what I did all day, was pull it out, and she got mad at me on the phone.
Oh, got mad at you saying, stop pulling your hair out?
Yeah, and I says, okay, you come and stop me, you know, you're 4,000 miles away, you know. And then I was going back to work actually that Tuesday, and I decided to go to the hairdressers that Monday and just shave and just get it all off.
Okay.
Yeah.
Great.
But it didn't all actually fall out. It was more on the top.
Okay.
The sides stayed.
Okay. Boy, don't I know that feeling.
Yes, you know. So you saw the little, you know, the hair in there, but the top was smooth.
Okay.
Yeah.
And you said everybody loved it, and you looked great.
Yes,
right?
I had doctors. I had some doctors come up to me asking me how I felt, because they were just as bald. And they wanted to know, because when it started to grow, well, how are you doing that? I said, it's just growing back.
Oh.
But it took a few months, but that's okay. And now it's a curly.
It's fantastic.
Thank you.
Well, it's beautiful. It's beautiful.
Thank you. I don't know what to do with it, though, so.
Well, that actually brings us to perhaps some of our ladies here today. We actually have some wonderful folks that are joining us today. We have Mary McAndrews, Lasting Looks of Sarasota. That's Sarasota, Florida. And she does breast aesthetics and areola repigmentation and permanent makeup, and specializes in oncology aesthetics and nutritional skincare. And we're so happy you're here today, Mary. It's delightful to have you. Thank you. And also today we're joined at this moment by Andrea Feldmar and Diane Witten of the Center for Building Hope. They've been in existence for over 17 years, and they provide free support services for family, friends, caregivers, support groups, immune system building, a number of wonderful things as it relates to cancer treatments and therapies and things. And we're so grateful that you're here with us as well today.
Thank you. It's our pleasure.
Absolutely. If I may, please begin with Miss Mary and discuss a little bit about what exactly it is that you do for oncology and for some of these folks as they're going through these treatments.
Well,
our facility is based on oncology aesthetics. We do areola repigmentation for after reconstruction.
Okay.
I do scar revision, so if there are scars to break down before the color goes into the areola, we do that as well. And with this, I had found so many patients had various skin conditions, so we started addressing a lot of those conditions, like broken capillaries and dehydration from the chemo or radiation. We do have a nutritionist on staff as well. She's a registered dietitian and a master's in nutrition, and so we try to address some of the diet issues as well after treatment.
Okay.
So that's primarily what we do. We have a lot of skincare treatments that we do, so when you're recovering, it's just always great to have your skin back in shape after going through such stressful treatments.
Sure. Now, curiously, of course, once someone goes through something as dramatic as chemotherapy, radiation, and those kinds of things, their skin will necessarily change. I don't know, does it change right in the area of the treatment? Does it change overall? And what kinds of things does your facility do to help that?
Well, there's a lot of scarring after the reconstruction. Not a whole lot, just really around the areola. So when I do the repigmentation, what I can do is break down the scar tissue a bit, and then start to implement the color, and it brings all the scar tissue into the pigmentation so that it's all camouflaged. So you can really go back to where you used to be, and visually when you look in the mirror you don't have that pale color there anymore, and the scars are camouflaged. So that really helps, I think, emotionally to just bring you back to where you were before all this started. And you know, as far as skincare issues, the texture of the skin does change. You know, the chemo and radiation tends to purge through your largest organ.
Yes.
So you can be left with lesions on the skin, broken capillaries. We have different machines as well as treatments that we use to alleviate the broken capillaries and really address some of the lesions on the skin. We try to take a very holistic approach to what we do. All of our products are, for the most part, they are, you know, paraben-free, chemical-free. Our makeups are all mineral. So when we address some of these radiation or chemo issues, a lot of times we use calendula or arnica, which are homeopathic herbs that help to heal the skin. So that's really just a wonderful thing that really just helps them feel better. And then we, of course, after the skin is treated, we can address makeup issues and hair loss issues as well.
I was just about to say, one of the important things about what you do, as you know, women, I mean, looks are very important to all people. Certainly for women, there's so much put upon women looking beautiful, looking, you know, made up and beautiful, and after going through something as challenging as what you've gone through, and many women have, you feel like maybe you've lost some of your character as a woman, your femininity and those kinds of things, and the kind of work that you do kind of helps in bringing some of that back and bringing the comfort and knowing that you're still a woman in the femininity. So what kinds of things, like when somebody comes to you, I mean, I'm sure what kind of state are they in?
Well, a lot of times, you know, women will come in as far as the areola recoloration. You know, we look in the mirror together at what color that they have and what scars they've been left with from the surgery. And what I do is I draw on them with some of the actual pigments. I mix colors for them and actually paint on them to show them what I can make the areola look like.
Right.
Everyone's healed a little bit different, so the scars are all a bit different. It's customized to each unique individual. And you know, if the nipple has not been constructed just perfectly, I can shade that and make it look much more realistic.
Okay.
So I use varieties of you know, color palettes to do that. As well as, because I've been a facial artist for over 20 years, if someone has lost their hair or is getting ready to lose their eyebrows or hair, a lot of times they have permanent brows done before they go into chemo, because then as the hair does grow back in after the fact, it grows right over where the permanent makeup used to be.
Sure.
So at least they have some, you know, shape there and a framing of their eyes.
Right.
So we do address a lot of the hair issues as well. And there's products on the market now that help regrow hair. I'm sure a lot of you have heard about. There's prescription ones and there's over-the-counter that do help to, and they're FDA approved, that help to regrow hair. So, and there's ones for the brows as well. But a lot of times I like to, when someone has been diagnosed, I like to see them beforehand, because I can get a snapshot of what they look like beforehand.
For certain. Now, you mentioned about losing hair. Obviously, at some point when the hair begins to grow back, that's fine. But in that interim time, wigs and hair pieces and things like that are very, very important. Does your business deal with that, or do you have somebody in conjunction with you that works on that?
We partner with the Center for Building Hope, and what we do is about 3 times a year, we close our doors from 9 to noon, and Andrea and a lot of the other gals at the facility bring patients to us. And what we do is we'll have a scarf tire and wig maker in one room just doing that, showing different ways of wearing scarves and fedoros and various wigs. And then we have another room that our nutritionist will be talking about, whole food supplements. We're all about food being your nutrition, not a pill.
Right.
And really talking about the nutritional end of it. And then we'll have our 3 other rooms working with addressing skin issues. They're like the rooms are broke out in little mini sessions, so everyone can get a free treatment.
Wow, that's great.
About, I would say 3 or 4 times a year, Andrea will bring patients, and we will offer that at the facility. So that's something nice to put out there. For sure.
And just, while I still have you on the mic, can you tell them about your facility and how they can get in touch with you about more information about that kind of thing right now?
Well, we have our website, which is www.lastinglooksofsarasota.com.
Okay.
Our number is 941-539-7990. And what we do is, if patients want to come and have some of these complimentary services, we offer it on our website. We post always our events that are happening, that are community efforts and such. So
great. That's wonderful. And this is, of course, Sarasota, Florida, and we're doing Sharon's Insights, a podcast sponsored by the Manatee Cancer Center, for those of you that are just tuning in. A great organization. And, of course, another great organization is the Center for Building Hope, which we just referred to a moment ago. Ladies, thank you so much for all of your involvement. Tell everybody a little bit about, if you wouldn't mind, Andrea, a little bit about what the Center for Building Hope does, and then, of course, you can pass it on over.
So the Center for Building Hope is an organization that provides free psychosocial services to anybody that's been impacted by cancer. So whether you're a patient or a caregiver, all of our services are free of charge, and we address all of the psychosocial issues. As Mary addresses some of the physical issues, we focus on support groups, exercise programs, educational programs, and even some social opportunities, because we're experts at creating a community.
Right.
And part of that community is making sure that people don't feel isolated.
Right.
And oftentimes, you get a cancer diagnosis, and the first thing you feel is alone.
Of course.
So we really pride ourselves on creating a community where people can come together, and that feeling of being alone is reduced. Diane?
Diane, please, carry on.
Another part of the work that we help cancer patients and families with include having them more knowledgeable about the cancer, their diagnosis, different treatments. Many times we have oncologists and other doctors come in speaking about the specific topics. We have groups where people meet, they have the same diagnosis, the same type of cancer. They will trade information. And what we try to do is give the patient and the family more knowledge so that they become an active part of their medical team. They feel less out of control with more knowledge, and they can make decisions about which treatment is right for them. We also have the classes that Andrea started talking about. In order to fight disease, we need to be psychologically strong and healthy. So we provide all kinds of opportunities for people to do that. We have yoga and qigong and cancer recovery exercise, watercolor, creative writing, meditation. And all these, again, are free to the patient, the family, the friend, the caregiver. People come and feel that their quality of life continues even though they have cancer.
That's outstanding. And you've been actually, in one name or another, you've been in this community in Sarasota, Florida for over 17 years, is that correct?
That's correct.
Wow. And how long have you been involved with the organization?
I've been with them for 4 years.
Okay.
And I've met wonderful people who have helped us provide services. And my role is also to go into the community and tell people what we do and how important it is for people to get the support they need to go through the treatment, recovery, and their life is still very active and
important.
Rejuvenating, important.
Yeah, absolutely. Now, Andrea, what is your specific role at the Center for Building Hope?
I'm the program director.
Okay, so you sort of organize all the things that were described as far as
Exactly.
Qigong and yoga and all those kinds of things.
All the programs, the speakers, the education, everything all of the services that are provided to the participants to improve their quality of life.
Sure. Now, if they want more information, again, we'll talk about it again, but if they want more information about where you are and that kind of thing, why don't you tell everybody right now?
We are on the internet at www.centerforbuildinghope.org.
Okay.
Our phone number is 941-921-5539.
Beautiful. And if somebody is watching this in a faraway place, do you have to live in Sarasota County, Florida, to have access to it, or Manatee County, or can you be from North Carolina and say, I want to go and experience this for myself, or how does that work?
Well, primarily we serve Sarasota and Manatee counties. However, anybody that walks through our doors, we are absolutely willing to provide services for them. So if they live in North Carolina and they're down here getting treatment, they certainly can utilize our services down here.
Wonderful. That's outstanding. I mean, it is so great to be in a community like Sarasota, isn't it? Where we have such great people like Mary McAndrews, and providing, as it Lasting Looks of Sarasota, to do this wonderful makeup and reconstructive things for them, and also Center for Building Hope for everybody as they get through this difficult time in their lives. It's been really wonderful to have you on, and you stick around, because when we get back, we're going to talk to some other folks here on our podcast sponsored by the Manatee Cancer Center. We'll be right back. Thank you for listening to Insights, produced by the Manatee Cancer Center. For more information on upcoming podcasts, visit www.manateecancercenter.com.